Hello everyone. So today I will be going over my evidence-based project. My name is Gerardo Navarro and my clinical preceptor was Dr. Roberto Vargas. And my topic is community social determinants of health, homelessness, violence, and substance abuse. So for the significance of the problem, I want you guys to understand that there are a lot of social determinants that affect the health of communities. In recent times, we have seen the effects that homelessness, violence, and substance abuse have had in LA County. According to the 2023 Greater Los Angeles homeless count, the County of Los Angeles has an estimate of 75,518 people experiencing homelessness. The city has an estimate of 46,260 people experiencing homelessness, and Spot 6, which is our service planning area, our region of South LA, has 12,995 people experiencing homelessness. And that's according to LASA recent homeless count, which was released about a month ago. Now, this is a 9% increase in homelessness in the county, a 10% increase in the city of LA, and a 10.9% decrease in Spot 6. Further data shows that unsheltered homelessness is up 40% over the last 5 years. There has also been a rise of the use of amphetamine-type stimulants in the United States, according to SAMHSA 2019. And in 2021, 46.3 million people aged 12 or older, which is approximately 16.5% of the population, have had substance use disorder in the past year. This included 29.5 million who had an alcohol use disorder and 24.0 million who individuals reported using substances. This was an increase of 26% in 2022. Additionally, violence is the leading cause of injury, disability, and death. If the individual survives the violence, they are then faced with physical, mental, and emotional health problems throughout their lifetime. To help prevent homelessness, violence, and substance abuse, the underlying social determinants of health need to be addressed, which include root causes of inequality and social disadvantages. Now, in recent times, we have seen the effects of homelessness, how that affects individuals' health. And in people experiencing LA County during the COVID-19 pandemic is a recent example. After adjusting for age, the mortality rate among people experiencing homelessness was 570.7 per 100,000. People experiencing homelessness had nearly twice the risk of dying from COVID-19 as people in the general LA County population, which was 287.6 per 100,000. Those people experiencing homelessness aged 18 or 29 years had almost 8 times the risk of dying compared with their peers in the general LA County population. These mortality rates in LA County show the negative impact that homelessness has had on the health of the communities. Now, I want to discuss my evidence-based project question, Peacock question. In people experiencing homelessness and affected by violence and substance abuse in LA County, what social programs and outreach healthcare interventions may improve outcomes for those experiencing homelessness within a year follow-up period when compared to prior year's trends in LA County and other trends of outcomes from other regions during the same one period. Now, to discuss that, I had to review different databases and literature. I got information from SAMHSA, LASA, PubMed, and EBSCO. Key terms that I used were unsheltered, housing instability, drug use, alcohol, illicit drugs, tobacco, and smoking. And the database for violence was based on the U.S. Department of Justice, and violence is defined as violent crimes such as murder, rape, and sexual assault, robbery, and assault. Now, for the summary of the evidence. It was based on 6 scientific articles that were compared measuring social health determinants. Designs of these articles were aligned with each other, being survey questions, interviews, qualitative methodologies, and cohort studies. In addition, one of the most common approaches seen throughout these studies were survey questionnaires, either screening or interviews that were then transcribed based on the study's key variables. This is a very common approach taken by research studies that are conducted by key informants who are trained professionals who have had extensive training and experience with the target population, which is the case in the homeless individuals. Individuals who participate in the study met criteria in either homeless, unsheltered, living in a shelter, or have been homeless in the past. Various dependent variables were used for these studies to measure social determinants. To name a few, these dependent variables were violence, physical, emotional, and sexual violence, drugs, childhood traumas, health problems, substance abuse, and sleeping reports. The variables are measured in various ways, such as numerical data, qualitative data based on interview transcriptions, binary variables, ordinal or ratings on a scale of 1 to 5. Recommended interventions were addressing risk factors that led to homelessness, risk of victimization, and risk of substance abuse. In addition, these interventions were finding stability, housing for individuals at risk of being unsheltered, approaches in trauma-informed care, and substance use treatments. Now, as for the recommended best practice plan of action, so currently LA County has a homeless countdown every year. We will use that data to see which spa are hit the hardest to allocate our fundings correctly. Every spa has nonprofits who are equipped with housing navigators to assist people experiencing homelessness with shelters, temporary housing, Section 8 housing vouchers, hotel vouchers, and permanent housing. There are barriers such as language, having proper documentation, but that is all taken care of with the help of the translators and document specialists. Most importantly, LA City and County own a lot of the empty houses and empty lots, which can be repurposed for transitional housing and or permanent housing. So, tenancy services, and this includes treatment plans for substance use disorders, violence prevention workshops, care management, funding for relocation, and mental health services. These tenancy services will further help our participants improving their livelihood and their emotional, mental, and physical health. Income interventions, particularly housing subsidies with case management, show long-term improvements in the number of days stably housed. Now, for our policy and protocol for practice change, our policy is homelessness is increasing in many parts of the county. Evidence shows that certain services help reduce the impact of homelessness and the impact of substance abuse and violence on homelessness. City and county governments will require these agencies who are giving these services to provide data of the outcomes for those receiving services. This policy recommendation will help us better assess the real-world effectiveness of interventions of the research. And our rationale is that the services such as violence prevention and substance abuse treatments are typically requirements for transitional housing to help people stabilize their lives and get back to living a healthy lifestyle. Violence prevention, substance abuse treatment services are indicated as a requirement because people who experience housing instability have a greater chance of engaging in substance abuse and have experienced violence in their lives. And income interventions, particularly housing subsidies with case management, show long-term improvements in the number of days stably housed. And continue for the procedures. So we would have interim housing, transition to permanent housing. The rationale would be interventions to prevent homelessness are more beneficial to individuals who have a speedy recovery and more likely to transition to permanent housing faster than someone already living on the street for some time. Violence prevention strategy services. This prevents people from enduring further violence in their everyday life. As for substance abuse treatment services, addresses the issue of illegal drugs by having support groups and sobering centers and income interventions. This will definitely help alleviate the disparity of income that some may have. Now, for our implementation plan, to address homelessness, violence, and substance abuse, we will begin by mitigating homelessness, assuring individuals who are unsheltered enter into temporary housing and then potentially permanent housing. This will do with the help of LASA and other nonprofits corresponding to their SPA that they service. Within a year period, contracted providers and managed care plan partners will assist in finding individuals enrolled in their programs to help find temporary housing, interim housing. Health insurance will also help in identifying their members who are homeless so that those individuals can receive the resources that they may need. The participants will also have case management to help guide them. Once they are in interim housing, they will have tenancy services that include treatment plans for substance use disorders, violence prevention workshops, care management, funding for relocation, and mental health services. They will receive job training opportunities so that they can learn skills and how to properly implement them in the job field that they would like to pursue. Having street medicine teams go to homeless populations would also help alleviate health disparities while they are waiting for interim housing. LASA and other nonprofits will locate and send necessary resources to these individuals. Tackling these issues would take multiple years. A realistic goal would be 10 years, with short-term goals being yearly checks and evaluations. Implementing and improving the LA social safety net would also help prevent those who are facing housing instability from becoming homeless. And one way that the city is actually currently using their interim housing would be through the tiny home program or the project Lock Key House. And what they do, they have actual nursing and other street medicine teams go to these interim housings and do basic health assessments on these individuals, making sure that they are not infected, they're seeing their proper care, they're getting their medication, and if needed be, they get referred to a primary care physician. Now, for the evaluation plan. Every quarter we would evaluate how our efforts are working and if it's even helping. The outcome will be finding temporary housing and potentially permanent housing to individuals experiencing homelessness. In addition, offer resources to prevent violence and substance use disorders. This will be measured by the success of housing those who are homeless within the year-long period and possible extensions. Moreover, with tenancy services for those individuals that they have a healthier lifestyle. Tenancy services are measured by going to the violence prevention workshops and sobriety groups. Successful completion of job training classes will also be part of the measure of success. In our plan, we will be following them for over a year and do quarterly evaluations to see how effective and efficient our plan is proceeding. Those accountable to collect the data would be the contracted providers and managed care plan partners that will be sent over monthly to verify the services given to the individuals enrolled. Feedback will be given based on performance in getting individuals to housing and tenancy services. Agencies that are showing the best results will be acknowledged and given more funding if they can continue to replicate such results. And this is my reference page, and that is the end of my presentation. I want to say thank you for listening. I hope you guys have a great day.